Okay, we're here today with Eli, and Eli's about to start his treatment with Dr. Davis. So, Eli, let's talk about that knee. You're having right knee pain?
Yes, ma'am.
And when did that start?
Oh, it started 5 years ago. 5 years ago, I underwent a surgery, and the surgery kind of fixed it, but not completely. So I haven't been able to walk normally since, and the doctor just giving me shots of I don't know what kind of of how you call that
The steroids or the cortisone?
steroids.
Okay.
Steroids. They give me steroid, and he says, "Okay, I see you in 2 months." So it seems to me like it's about time to start something different.
Right.
Because that hasn't worked at all. I believe this is going to work for me, and for what I've seen, all the testimony from all the patients that I see with their smile, and it cannot be a fake. I mean, what they say, you could see in their eyes, and I said to myself, I want to have that too.
You want to be able to smile like
I
they
wanna-
smile.
Yes.
So, what's a typical day like for you?
Well, normally I'm a school teacher,
Okay,
which requires that I have to move in my room
sure.
back and forth. There's not much involved, but basically, I would love to go back and have my life back. In the sense that I would like to walk in the afternoon, do a little bit of exercise, and with this knee, it's simple. I cannot do it.
Right.
I cannot do it. As the moment I start walking, in less than 3 minutes, my knees start to hurt and I feel pain.
Yeah, that's not okay.
Nah.
So, what is your discomfort today before we even get started? I know it's kind of early in the morning, so you probably haven't done too much.
Yeah, well, my knee, I would say it's like a 5, maybe a 6, because it really gets worse when I walk.
Okay.
As it is right now, it's not hurting me much, but I still could feel it.
Okay.
Yes.
Okay. All right. So I'm going to have you do a couple different exercises for me. The first thing I'm going to have you do, Eli, is just stand up for me. If you could just stand up. Did you feel pain when you did that?
Yes.
Where did you feel the pain at?
Right here.
On that inside?
Yes.
Okay. All right. So I'm going to have you take 2 steps forward. I'm going to have you put your feet shoulder length apart. Arms straight out in front of you. Keeping your heels on the ground, I'm going to have you squat down as low as you can. And then slowly come back up. I saw that in your face. Okay, where did it hurt? Where did you feel the pain when you did that movement?
Well, now it hurts on the back
Low back?
and also right here.
On the inside, still the
Yeah.
same spot,
Yeah.
right? Okay. All right, Eli, we're going to go up and down the stairs. There's a railing there that you can hold on to. We want to see how you maneuver stairs. Okay, now we're going to turn around and go back up. Okay, so Eli,
Yes, ma'am.
was it worse going up the stairs or down?
Down.
Down the stairs was worse, and that same spot?
Yes.
That same spot. That's your problem area right there. All right, so we're going to go ahead and get started, and I can't wait to see your after video. Are you ready?
Alrighty.
2, 3, 4, 5, 6, 7. Release it. Good. And I want you to just hold there a second. Hold. No, relax.
That's the muscle that I feel some
Yeah, that-
numbness when I drive my car for 1 hour.
Yes.
I feel something there, like
Mostly on the right side.
yes.
Okay. Good. And go down and out. 1, 2, toes out. 3, 4, 5. Good. Okay. And relax it. Take a deep breath. and go down and out. 1, toes out, 2, toes out. Good. Okay. Relax your leg here. Take a nice deep breath and go down and out. Turn those toes out. Out with the toes. Yes, keep going. Turn the toes out. Good. Shake your legs
All right,
out.
Eli, I'm going to have you just walk down to the end of the hall and back. How you feeling?
I feel great.
Come on back.
I'm feeling like I'm walking normal.
Yes. Yes, you are. Yes, you are.
I'm walking like an old man.
No more old man walk, right? All right, we're back with Eli, and look at him smile. All right, Eli, I'm going to have you stand up for me.
All right.
How is that?
Oh, it feels great.
All right, I'm going to have you take 2 steps forward. Feet shoulder length apart. Arms out in front. I'm going to have you squat down for me. Whoa, that's fast. And come back up. Look at that smile. All right, let's do the stairs. Oh, look, no hands, and you're walking tandemly. Did you see that?
Yeah, that's amazing.
Did you see that?
No pain.
No pain. You started off with like a 6 or a 7. What do you think it is now?
Probably less than 2.
Yes! I love this part of my job. All right, are you happy with today's visit?
I'm very impressed. I'm very happy.
And what changes have you noticed, Eli?
I noticed that my muscles from my legs are not that tight as they were before. Sometimes the doctor worked with me, so he loosens the muscles around my knee area.
Right?
It's kind of a resetting all the brain function to the muscles, the signals.
Yes.
And I feel very, very, very different.
How's that low back feeling?
It feels nothing.
No pain at all in that low
nothing,
back?
because I believe it's related.
Yes.
Everything is related, the knee and the back.
Yep.
So what was forcing me to walk the way I was walking, like limping like this, probably put an enormous stress on my back.
Sure.
And that's why, since I'm kind of walking normal now, I don't feel no pain in my back, because my back is saying, "Oh, finally you rediscover how to walk normally."
Great. Oh, I'm so happy for you, and welcome aboard.
Thank you.